Hello, for this pathogen presentation, I chose to do methicillin-resistant Staphylococcus aureus, also known as MRSA. I chose this presentation because it was kind of personal for me. In 2004, I personally got MRSA and almost died from it. It started as a small red bump that was first thought to be a regular staph infection. Within just 48 hours, it turned into MRSA. The area became bright red and extremely painful to touch, with a small white ring in the center and a large red ring spread outward. My fever spiked to 104.8 and I went septic. I was rushed into emergency surgery where doctors drained the abscess on my abdomen. The infection had eaten down to the lining of my stomach. After surgery, my wound had been packed daily with cloth soaked in bleach water until it healed. I was given vancomycin, but I had a dangerous allergic reaction that caused my throat to swell and shut down, and I needed an epinephrine injection to survive. It nearly took 4 months for me to fully recover. MRSA infects the soft tissues of the skin, lungs, bones, and blood. In humans, the most comprehensive understanding is it can cause pneumonia, heart infections, bone infections, pus-filled wounds, and septicemia, which is poisoning in your blood. In animals, it can cause udder infections in dairy cows, skin infections in pigs, horses, dogs, and cats, and foot infections in birds. The symptoms depend on the type of infection, but mostly include red, swollen, and painful skin with pus, fever, cough, shortness of breath, or pain in the bones and joints. The incubation period for MRSA is usually 4 to 10 days for skin infections, but it can be longer or shorter for an infection deep inside the body. My classification for MRSA, the domain is bacteria, the phylum is Firmicutes, family is Staphylococci, and the class is Bacilli. MRSA spreads as simple as by touching the skin or body fluids of an infected person or animal. You can also contract this organism by touching objects and surfaces that have the bacteria on it. MRSA can easily pass from humans to animals or vice versa, especially in farm settings. To prevent the spread of MRSA, it requires you to have a good hygiene, such as washing hands often, keeping wounds clean and covered, cleaning all shared equipment, wearing protective clothing in hospitals or around animals, and avoiding unnecessary use of antibiotics. Most people would say that to prevent the spread, you should practice, again, good hygiene, keeping your wounds clean, making sure that if you have any drainage on like bandages, that you fully make sure that it's covered and that you don't touch it. Or if you do, again, wash your hands and don't share any equipment or towels, washcloths, anything like that. And in hospitals, wearing protective PPE also helps to not create patient-to-patient transmission. Signs and symptoms most often start with the skin. Signs of skin infection include red, swollen, and pain in a painful area that might have pus. It can look like a spider bite or a boil. Infections in the bones or joints can cause pain in those areas. It was extremely painful when the doctor went to try to touch my wound when he was trying to see exactly what was wrong with it. In most severe cases, MRSA can lead to sepsis, which is a sort of like a blood poisoning, or it actually is a blood poisoning. And this can cause a rapid heart rate, fevers, chills, just like I had, confusion. Some people can be extremely confused when there's poison in the blood. And in most severe symptoms, it can be extremely life-threatening, just kind of like how mine was. And I had to be rushed into emergency surgery. Um, Doctors test for MRSA by taking a sample from the infected area and growing it in the lab to see which antibiotics will work well. Special tests like PCR, polymerase chain reaction, can detect MRSA gene that makes MRSA resistant. Quick nasal swabs are also used in many hospitals to check if someone is a carrier by using serofexin test to identify certain MRSA strands. Small MRSA infections are often treated with antibiotics like clindamycin, doxycycline, or draining the infected area can be a most important step, kind of like how they drained my abscess. Um, More serious infections require more strong antibiotics, and typically those are intravenous or by IV. And those include vancomycin or Lysolid. I've never heard of that one before, but the doctors, like I said, did vancomycin with me, and my body just didn't like it at all. There's no vaccine currently for MRSA, and getting the infection once does not make you immune in the future, and you become a carrier for MRSA. So you can get it several times. Anytime you have an infection, you have to, not even of an infection, a sore, you have to make sure that that area kind of stays clean because you can get MRSA again. I found this kind of cool. So there's a new research out from a group of scientists at Zeehange University, and they developed a new treatment that can turn MRSA to stone. They made medicine called APC, which is antibody polycystic acid conjugate. And by attaching a special antibody to polycystic acid, this medicine sticks to MRSA and covers it with like a calcium. And it forms a hard shell that stops the bacteria from growing and makes it easier for the immune system to destroy. They used it in mice, which is kind of sad, but they use it in mice with bone and lung infections. This treatment worked much better with the animals and also had a calcium rich diet. While it did not work as well for sudden infections, it can be very helpful with long lasting ones that do not respond to regular antibiotics. So it looks like they are really still trying to test this out and see what they can actually come up with to treat this really kind of difficult bacteria that kind of forms together in clusters or grapes if you look under a microscope and see how they can really attack it and destroy it so that it's not resistant to medications and easy to destroy so that it doesn't keep reoccurring or causing really serious infections, really serious spreads to kill people. So I hope that you like my presentation. I really enjoyed working on this presentation and kind of putting together my slides to make sure that you understood more about methicillin staphylococcus aureus, or otherwise known as MRSA. And thank you.